Have you ever checked your blood pressure, seen 120/80, weak or unsteady even when their blood pressure reading looks good? And have you ever asked yourself this question, what if the number looks right on paper but does not feel right in real life? If that thought has ever crossed your mind, then stay with me, because this may matter more than many older adults realize. Hello everyone, welcome to Senior Health with Dr. Sarah Mitchell. Today, we are going to talk about a health topic that many older adults and seniors often worry about, but do not always understand clearly. Many seniors are told to keep their blood pressure under control and that advice matters. High blood pressure can raise the risk of stroke, heart disease, kidney problems, and other serious health issues. But there is another side to this topic that many people miss. Some older adults also deal with dizziness, weakness, or feeling unsteady when they stand up, and that should never be brushed aside. And this is where many people get caught off guard, because some older adults have a reading that looks fine, yet they do not feel fine. They stand up and feel lightheaded. They get out of bed and need a moment to steady themselves. They rise from a chair and suddenly feel weak in the legs. At first they may ignore it. They may think, maybe I stood up too fast, maybe I'm just tired, maybe this is part of getting older. But what if it is not that simple? What if the real issue is not only what the reading says while you are sitting down, but what happens to your body when you stand up and try to live your normal day? That is the question we are going to walk through together. Let me start with a story that may sound familiar. A woman in her 70s had been trying very hard to do everything right. She took her medicine exactly as told. She checked her blood pressure at home. She listened carefully at every appointment. And when she finally started seeing readings close to 120/80, she thought that meant she had reached the safest place. But after a while, something changed. She began feeling dizzy when getting up from the sofa. Then she noticed it in the morning, when she got out of bed. Then she started slowing down every time she stood up, because she no longer trusted that her body would feel steady right away. She tried to ignore it. She told herself it was normal. She told herself maybe she just needed more sleep. She told herself maybe she needed to drink more water. But the dizziness kept coming back. And one night, when she stood up quickly, she almost lost her balance. That moment changed everything. Not because she fell, but because she became afraid of falling. And once that fear enters daily life, many other things begin to change too. A person may walk more slowly. They may avoid stairs when possible. They may stop getting up as often. They may think twice before going out alone. They may keep a hand on the wall or a table just in case. And little by little, confidence starts to shrink. That is why this topic is not only about a number. It is also about daily life. It is about feeling safe in your own body. It is about being able to get up, move around, and trust your next step. And this is where many seniors get the wrong idea. They think if the number looks better, they must be safer. But if the number looks better while the person feels weaker, dizzier, or less steady, then something important may be getting missed. That is the part many people do not hear clearly enough. Now let's slow this down and make it simple. Is 120/80 always bad after 65? No, that is not the message. For some people, that can be a healthy reading, but it is not a perfect rule for every older adult. That is the key point. Blood pressure care after 65 becomes more personal. Because the body changes with age, arteries can become stiffer. The body may respond differently when standing. The same medicine dose may not feel the same at 72 as it did at 52. And the same number may not feel the same for everyone. That is why symptoms matter. Now think about two older adults. One feels steady, walks confidently, and has no dizziness. The other feels lightheaded when standing and needs a moment to balance. Both may have similar readings, but their real-life experience is very different. And that difference matters, a lot, because daily function matters, confidence matters, safety matters, and quality of life matters. Now here is something very important. Dizziness when standing should never be ignored, even if it lasts only a few seconds, even if it happens once in a while. Even if the blood pressure reading looked good earlier, because one moment of dizziness can lead to one bad step, and one bad step can lead to a fall. So if this keeps happening, it is something to take seriously, not something to brush off as just aging, not something to hide because you do not want to worry your family, not something to keep to yourself until it becomes worse. Let me give you another quick example. A man in his early 70s had good numbers on paper. At every visit, he felt reassured. He thought he was doing well. But every evening, when he stood up from his chair, he felt a short wave of weakness. At first it was mild, then it started happening more often. He began standing slower. He began pausing before taking the first step. He started holding on to things without fully noticing he was doing it. He did not think much of it, but his daughter noticed. She saw that he always placed one hand on the arm of the chair before standing. She saw that he would wait a moment before walking. She saw the small hesitation that he had stopped noticing in himself. And that small change told a bigger story. Sometimes others notice what we ignore, and that is why this topic matters for families too. It matters for husbands and wives. It matters for adult children. It matters for anyone who helps an older parent with medicine, doctor visits, or day-to-day care. Because sometimes the question is not only what the reading says. Sometimes the question is, how is this person actually doing? Now let's be clear about something else. This does not mean higher blood pressure is always better. That would also be too simple. High blood pressure still matters. It can quietly damage the heart, brain, kidneys, and blood vessels over time. So the answer is not to ignore the numbers. The answer is to understand the full picture. Some seniors need stronger control. Some need a more careful review. And some need to look at what happens when they stand, not just when they sit. That is the part many older adults never hear explained in plain language. They hear the target. They hear the warning about high blood pressure. But they do not always hear enough about symptoms. They do not always hear enough about how they feel during normal daily movement. They do not always hear enough about what happens after getting out of bed, rising from a chair, or standing in the kitchen for a few minutes. And that missing part can matter a lot. Because blood pressure is not only a clinic topic. It is a daily life topic. It affects mornings. It affects walking. It affects confidence. It affects how safe a person feels in their own home. Now let's talk about another common mistake. Some older adults think that if they are not fainting, then the dizziness is not serious. But that is not a safe way to look at it. You do not need to fully pass out for there to be a problem. Feeling lightheaded, weak, unsteady, or strange when standing can still be a warning sign worth discussing. In fact, many problems begin with smaller signs: a brief dizzy spell, a slow pause after standing, a hand reaching for the wall, a fear of moving too quickly. Those moments may look small, but they can be the early signs that something deserves a closer look. And this is exactly why I wanted this video to go deeper than a simple yes or no answer, because older adults deserve more than a quick slogan. They deserve a clear explanation, they deserve a calm explanation, and they deserve information that respects real life, not just a number on a screen. Now let's talk about what you can do. If you are checking your blood pressure at home, keep a simple record, write down the numbers, but also write down how you feel. Did you feel dizzy after standing? Did you feel weak? Did you feel steady all day? Did you need to hold on to something after rising? Did you feel more tired than usual after getting up? Did mornings feel worse than afternoons? Did the feeling happen every day or only once in a while? Because numbers alone do not tell the full story, and feelings alone do not tell the full story either. But together, they can paint a much clearer picture. Then take that record to your doctor and ask this simple question: should my blood pressure goal be based only on my sitting reading, or should we also look at what happens when I stand up? That question can change the whole conversation. It is simple, it is respectful, and it gets right to the point. You can also ask this: could any of my medicines be making me feel dizzy when I stand? That matters too. Because the goal is not just better numbers. The goal is better daily life, feeling safe, feeling steady, feeling confident, feeling able to move without fear. Now let's talk about something emotional that many older adults may not say out loud. When a person starts feeling unsteady, even for a few seconds at a time, they may begin losing trust in their body. They may not say it directly, but it shows up in small ways. They may sit longer before standing. They may avoid getting up at night unless they really have to. They may stop going outside alone as often. They may become more dependent on someone walking beside them. They may begin to worry silently. And that silent worry matters, because once fear enters movement, life can start getting smaller. That is why this topic matters so much, not just because of blood pressure, but because of what blood pressure can mean in real life when the person no longer feels steady and sure. Now here's another point many people miss. Some older adults feel pressure to chase the most perfect-looking number. They want to be told they are doing well. They want to hear that everything looks right, and that is completely understandable. But a good plan is not always the one that simply produces the neatest number. A good plan is the one that helps protect health while still fitting the person's body, age, symptoms, and daily life. That is the balance. And that balance is where good conversations with a doctor become so important, because the right question is not always, how do I get the lowest number possible? Sometimes the better question is, what target is safest and most suitable for me? That is a better question. A more complete question. A more useful question. Now let's pull this all together. If you are over 65, blood pressure still matters. That part is very important, but the safest plan is not always one number for everyone. For some seniors, the problem is pressure that stays too high. For others, the hidden problem is feeling unsteady in daily life, even when the reading seems fine. That is why the full picture matters. Your numbers, your symptoms, your age, your medicines, your confidence when standing, your strength during the day, and how you feel when you move through normal life. The biggest mistake is thinking only one number matters. A better way is to look at the number and the person together. That is where better decisions begin. That is where safer care begins. And that is why a reading that looks good on paper may still need a closer look in real life. So if this topic sounds familiar, do not panic. Do not change anything on your own. But do pay attention. Do keep track. Do speak up. And do bring the full picture to your next doctor visit. Because sometimes one simple question can lead to a much better conversation. And sometimes a better conversation can lead to a safer daily life. Thank you so much for watching Senior Health with Dr. Sarah Mitchell. If this video helped you, please like, subscribe, and turn on the bell so you do not miss our next health updates. Please remember, this channel is here to educate and inform, but always consult your doctor or healthcare professional for advice about your own health. Please take care, stay safe, and may God bless you with better health, peace, comfort, and strength every day.